They saved my life. So I have a second chance at life now because of them.
That man just released from the hospital 4 months after he was diagnosed with COVID-19. He was close to death and he needed a lung transplant to make it through.
A lot of high fives there today. He's in his early 40s, very young, otherwise very healthy, but this transplant was needed to save his life.
My kids, they were called up a couple of times to say goodbye to their dad because they didn't think that I was going to make it.
Fire Captain Randy Blake nearly didn't survive his COVID diagnosis.
When it became apparent that my lungs were in bad shape, they started to talk about the transplant option.
He caught the virus in his home state of Oklahoma in October, and for months he battled the virus, but his lungs only got worse.
My lungs were not sustainable, so without the transplant, I was done.
He ended up coming to Phoenix, where a lung transplant at Dignity Health St. Joseph's Hospital and Medical Center saved his life.
I'm just thankful, beyond thankful.
Randy is only 44. He's in good shape with no prior medical conditions. He never thought it could get this bad.
I thought that if I got it, it would be like maybe the version of the flu and I would move on, and that wasn't the case at all. It almost killed me.
His doctor says it's a reminder that COVID-19 can affect anyone.
Just because you're young doesn't necessarily mean that you're invincible. He's only 44. He's not in his 70s or 80s. He's 44. He's young still. And so COVID can affect you regardless of age.
Thankfully, with this transplant, Randy's got much more time with those he loves.
With the transplant, he walked out of the hospital today with his family.
It's been a very, very tough experience, but there's also been a lot of blessings.